Women's Health at The Ohio State University Medical Center, and we're talking about taking charge of your health. Dr. Jackson, you serve as the Vice Chair for the National Institute of Health's Women's Health Initiative, which I remember is just a major longitudinal research study that really focuses on major health issues for postmenopausal women as they age. Can you tell us a little bit about your work with osteoporosis and hip fractures?
So probably over the last 20 years, my major passion has been to reduce the impact of osteoporosis and osteoporotic fracture. And most of my work has been really in two major areas within that. The first is really understanding those factors that predict who is at risk for osteoporotic fracture. When one looks at the statistics, more than 50% of women have low bone mass. And in fact, by the age of 75 or 80, almost every woman has low bone mass, yet not every woman fractures. And so to understand those additional factors that really help to predict which of us would benefit the most from either lifestyle changes or from the initiation of medication that reduces fracture risk becomes increasingly important. More recently, a lot of my attention has turned towards understanding the genetic factors that are associated with this, because certainly who our parents are is the best predictor of whether or not we'll have an osteoporotic fracture. And so we've actually done the most definitive study at defining some of the genes that are going to be associated with that. And what we hope is that eventually we'll be able to have a relatively easy genetic panel that'll be able to tell individuals what their independent risk will be, and then the strategies that might be most effective for them. I think the second major area of my emphasis has been what are the lifestyle changes, or what are the, in fact, drugs that are effective at reducing risk for osteoporotic fracture. I was the principal author of the calcium plus vitamin D trial of the WHI in terms of looking at the role of taking calcium and vitamin D supplements at reducing fracture risk, and have been actively involved in the hormone therapy trials as well as a number of other new treatment trials and exercise interventions to reduce risk for osteoporosis.
So what is the recommendation regarding calcium and vitamin D?
I think it's important to understand with calcium plus vitamin D, what you're doing is you're laying the foundation for bone health. That if one has inadequate calcium or vitamin D intake, and it ends up being that adequacy is about 3 to 4 dairy servings per day, and probably upwards of 1,000 to 1,500 units of vitamin D, much higher actually than what we previously had thought and what the current RDA is for vitamin D, that really allows us to reach our ideal peak maximum that's genetically determined. But that alone is rarely sufficient treatment for reducing osteoporotic fractures in individuals who already have significant osteoporosis. So again, it's something that everybody needs to attain, but as a treatment for osteoporosis, it's rarely adequate in individuals who already have significant osteoporosis.
Okay. Women and men have many of the same health problems, but they seem to affect women differently, and that's, I think, why the Women's Health Initiative is just such a critical research study. What are the common symptoms of heart disease for a woman that distinguishes that from a man?
So the first thing about heart disease in women is that you rarely see heart disease before the age of 55 in women, and that's because women's estrogen levels during their premenopausal years actually help to protect them. They have better cholesterol levels. They have a number of factors that actually put them at lower risks. So men's first heart attack is frequently in the 4th decade of life. Women's tends to be in the 6th and 7th decade of life. However, when women have their first heart attack, it's far more likely to be a more aggressive course following that. So they're more likely to develop congestive heart failure, they're more likely to have a second episode of angina or a second MI, and so being aggressive is important. I think the third issue is that women often present with more atypical chest pain, and so the symptoms are often missed. You know, when men present to an emergency room, it's often that elephant crushing on my chest, and associated with radiation of pain down the arm, kind of those classic things that all of us. Women often will think maybe I had indigestion, or they'll have jaw pain, or they'll have something different. So I think it's important to be aware of those subtle differences that occur and make sure that you take those seriously and don't just ignore them. And then lastly, unfortunately, is that women are often later to get to treatment. So even when women present to the emergency room with these symptoms, there tends to be somewhat of a delay before they get the kind of interventions that men often get as much as 30 to 60 minutes earlier. Those things which can help to decrease morbidity and mortality associated with a heart attack.
So it's really important that women sort of advocate for themselves around
Absolutely.
that. Menopause and pregnancy are unique to women, of course, and so where are we with hormone replacement therapy?
Well, hormone therapy certainly has changed a lot in terms of our recommendations. And I think where it is, and I would say that the results of the Women's Health Initiative, along with several other studies, have really helped us have a clearer picture of its role in the management of postmenopausal women's health. So for women who are having severe hot flashes and sleep disturbances and vaginal dryness and other things associated with the estrogen deficiency of menopause, estrogen is an effective drug for managing those when they can't be managed with lifestyle or other types of modifications.
Mm-hmm.
However, where we've changed with postmenopausal hormone therapy is we no longer recommend it as the panacea for decreasing all the health concerns that are associated with aging. So although it's a very effective medication actually for reducing risk of osteoporotic fracture, that benefit is balanced by its increase in risk of breast cancer, its increase in risk of heart attack, and its increase in risk of stroke. And so when you look at the balance of risks and benefits, and in fact whether it's hormone therapy or any other medication or in fact lifestyle choice that you do, you really need to weigh that risk to benefit ratio. What we're currently recommending is that women should not initiate hormone therapy unless there is a specific indication for doing that, and it's really primarily centered around postmenopausal symptoms.
Okay, I have two young daughters, age 11 and 15, and apart from trying to resist nagging them about health and lifestyle issues, my approach generally is to try to serve as a good example or as a good role model by trying to take care of myself, exercise, eating as well as possible, and just focus on that. What else can moms do of daughters, or moms and dads of daughters, to help them develop healthy lifestyle choices?
Well, I think that there's a number of things. So first of all is you can actually include them in kind of planning meals and thinking about things. So, bring them to the grocery store, talk about food labels in kind of a fun way of doing it. And so make them part of the choices, and then show them how you can make healthier choices while still doing things that are fun to eat or fun to do. I think second of all is that you incorporate exercise in subtle ways within things, so that rather than parking at the closest parking space, maybe you show them it's okay to park at the further one and to walk in.
Mm-hmm.
Or you make this kind of part of the social activity rather than sitting around or sleeping in late on Sunday morning. Make it where you all go out and play a game of badminton, or you do something like that. And then I think it's important that we show them about moderation and alcohol intake, avoiding cigarette smoking, and having healthy interpersonal relationships. I think that the way that you show them how you love them and take care of them and nurture them will be ways that you're setting the foundation for them to do the same thing in their lives as they grow older.
Down the road for their own families. Dr. Jackson, we really appreciate the time that you've spent with us today and sharing so much of your knowledge and expertise with our listeners. We're going to take a short break, and when we return, our executive producer, Margarita Finelli, and I will have some thoughts on today's program. We'll be right back.